Hi, good afternoon. I'm Anne. This is SteAnne. How do we get people to use this to get to the right place at the right time to see the right person? As a clinician and a physiotherapist in the NHS, there are lots of people that turn up at the wrong time, at the wrong place. So, despite the fact that you might already have a letter with a link to a website to know where to go with a map, when you get to the hospital, you might be overwhelmed. There's too many people, it's really busy, where do I go? Or it might be really quiet, there's no one there, where do I go? So, that was our problem. This is Cardiff Royal Infirmary, and it's very quiet. So we've all been to the hospital, we've all taken someone, so we wanted to know how can we make that better using the phone. So there were some examples of using information that you have in a shopping centre. So you have an interactive map. I want to go to Zara, how do I get there? Okay, real time, go up the elevator, turn left, it's got pictures on where to go. We use in hospital Wi-Fi. Can you use that everywhere in the hospital? Are there any dead spots? Could we have a video and show people real time how to get there? There's not always a receptionist. Could we have colour coding or a symbol to show where to go? Well, that might not necessarily be practical to take all the signs out and put them all back in again. We want to make it accessible, so not everyone speaks English or Welsh, so we need to have different language, and we need to have accessibility for those coming to physiotherapy in particular with walking aids, crutches. They might be in a wheelchair. We know that there are some apps available that wheelchair users can sign up to, and it will tell you if you're going to the cinema or your theatre where the accessibility entrances are. So we gathered the data. What can we do? We decided that we already give out some information, but it's in lots of different places. There's the Keeping Me Well website that we saw there. There's Cardiff and Vale University Health Board web pages on where to go. So we wanted to bring it all together. So our patient had this information. They knew what to expect. They knew what to bring, what to wear, and how to get to the hospital. When they actually get to the hospital, we've highlighted the map on the route through from the parking areas to where they need to go. But we've also then included a video. So this is what we could do.
Can everyone just do that? You're not doing that enough. So there is a video of a walkthrough. Have you seen property videos recently? Or competitions, sell new houses for a raffle ticket? We're thinking here, I think we call it multimodal communication. So we have a lot of people who don't want to see maps, they can't understand them.
Trying to get it, might work on.
I'll keep pressing it. So we just want to bring another option for people. Sorry, it does. So we put our clinic just where the lift was, where poor Anne was in the lift, and we've just done a walkthrough. It's really simple, and it can be done offline. It doesn't really need to be hosted. It should cache.
So we're going to do it for our department. We can do it for each location. We also do it that we can use it for new staff that come on board with their induction material so that they can see where they need to go, and that we can add that everything is together in one place.
Oh, the video didn't work.
Sorry about your video.
It's fine.
But we had fun watching you even record it.
Well, Can I just say to everyone, it's my first hack, right? I work in this NHS thing, and I listen to a lot of tech. What I can tell you is I really enjoyed building things again. And I said yesterday, I'm not using any AI, I'm just going to go back to my old world of just trying to do it. See, this morning at 10 o'clock, I was like, right, what's AI telling me I've done wrong here? So it's really good. It's really cool. To be able to build things.
Really to be able to build things.
Yeah.
Good job. Questions? Joe, how much of a problem is this?
Joe, we don't know the numbers, and I don't think, let's be honest, many public sectors would know the numbers of problems. They do find out from user need, and Anne, you're pretty...
I work in a clinic. We have people that come all the time. I couldn't find you, I've been to the wrong department, or they come to us when they should be somewhere else. And you can give a map, you can tell someone on the telephone, but actually having something real time that they can look at. So they've got the visuals, they might do it before they come, but then they've got a better idea where they're going. You would be able to see how many hits you had and how many people were turning up at the right time and not having this problem to be able to identify any change.
I found a piece of research that said that in the US, from a resource point of view, members of staff spend 30 minutes a week directing patients around the hospital, which is like a big implementation. James?
I'm just interested in your comments about building stuff. So as an insider, what do you see as stopping you building stuff for the NHS?
Procurement, governance, CDIOs sometimes, you know, it's just there's blockers, which is fine. People, we prefer to buy than build. We are coming to listening to colleagues from, I mean, GDS was a transformational thing in the sense of a mindset. So we are seeing more stuff happening in Wales, where I've recently joined. There's lots of good things going on, but it's really difficult to take it to the marketplace because there isn't one. So we may need to build an internal marketplace where it's all safe, it's all IG'd, you can use it and you can plug it in and play with it. So that would just connect to a booking system, which would give you then the data you need to give the output aligned to what clinic
so
you're
you're
in.
envisaging a virtual NHS environment.
I'm going to have to get some questions back to this because I've got loads of people who have questions about the product actually.
Yeah.
Is this an opportunity to crowdsource? You've got a huge
Absolutely.
patient population.
Okay,
Could they be delivering
so
this?
that's a good thing. Asha?
Absolutely.
Over the weekend, what user input did you get and how did that influence and change your products over the weekend?
That's a brilliant question because, where's Catherine? No, Dr. Catherine, would you mind sharing? Because you came to talk. We talked to you, didn't we? Would you mind sharing? You don't have to, but you came to us.
It's not because I'm a doctor, because I've just
No.
It's a physio. So I came to talk to them about my experience of being referred and how this might be from the patient journey point of view.
Sorry, I'm out of time. I didn't